Welcome to my channel Weight Lecture. Today we will discuss multiple choice questions on veterinary surgery. Okay. Question number first. Wound heal better at the environmental temperature of options A 30 degrees Celsius, options B 25 degrees Celsius, option C more than 35 degrees Celsius, or options D none of this. The right answer is options A, that is 30 degrees Celsius. Okay. Okay, whenever a wound loses moistures, the tissue of the wound temperatures will be drop out. Okay, so the cells and enzymes, we all know that work at best at the normal temperature, that is around 37 degrees Celsius. Okay, and when the temperature that decreases by as little as 2 degrees Celsius, although healing can be slow or even that cease. Okay. Questions number 2. When there is high fever, general anesthesia should be avoided because option A, capacity of drugs to penetrate central nervous systems increases. Options B, there is increased chance of arrhythmia. Option C, danger of acute hypovolemia, or options D, none of above. The right answer is options A, that is a during the fever, the capacity of the drugs to penetrate the CNS will be increases, so we should not be used GA during that fever time. Okay. Here's let's see the different stages of general anesthesia. Then stage first is actually characterized by analgesia, that is a analgesia means like pain relief conditions. Okay. At this condition, eyeball position is at normal place, and it is characterized by amnesia, where the loss of memory little bit, and euphoria condition. Okay. Similarly, stage second is actually characterized by that stage of excitement or stage of delirium. Delirium means like confusions. And in this stage, if we see that respiration is thoraco-abdominal respirations, and the animals show combative behavior, like fighting behavior. Okay. And stage 3 is actually that surgical anesthesia stage. In this stage, if we see the respiration pattern, then it's hypotension we found, and there is a respiration will be that regular, but the blood pressure is a hypotension, and the that animal is in unconscious conditions. And if we see the eye movement, then eye movement will be in decreases, and swallowing reflexes is lost completely. While stage 4 is known as like the shock stage or medullary depression stage, and in this stage the cough reflex is totally lost it, and then there is a respiratory arrest of animal will be take place. And if we see that the animal will respire by mean of gasping type of, and there is a cardiac arrest and depression we will see. And if we see the mucous membrane of that animal, it's found pale and white, and there is a no eye movement. Okay. Questions number 3. Paraphimosis refer to which of the following? Options A, failure of penile retraction. Options B, failure of penile extension. Option C, none. Options D, both A and B. The right answer is options A, that is failure of penile retraction. Okay. Paraphimosis is actually the failure of that penile retraction. Okay. Paraphimosis actually occur when the that foreskin which covering this penis is left retracted, uh, that is behind the glans palens. Okay. And if this retracted foreskin is somewhat tight, then it function as like a tourniquet, so that the glans penis, which is that above which is that the outside the retracted this prepuce layer gets swollen, and it's blockade this foreskin blockage the blood flow to this the outside glands, and okay. And while phimosis refer to the conditions where there is a failure of that penile extension. Okay. In this condition, the foreskin which is covering this penis is unable to retract properly back, so this lead to that failure of penile extension, and actually this is occur because of that tight foreskin. Okay. And in such condition, we have to give that triangular shape incisions to correct this phimosis condition. Okay. Questions number 4. Jeb's operation is related with the disease of options A, ear, options B, tongue, option C, nose, options D, eye. The right answer is options A, that is ear. Okay. Jabs operations or the lateral ear resect operation is related with that disease of ear. Okay. And this operation is actually indicated in case of that's a chronic otitis, that is inflammations of ear, and when there is a formation of a pus inside the ear. Okay. And when they have to give operations, we have to remove out that neoplasm from this ear canal. Such type of condition we have to that indicated this jabs operation. And at first we have to see that the that anatomy of that ear, that external ear is actually not straight tube. It has two portion. There's a straight, there's a horizontal, and there's a vertical portion. Okay. And in this operation we have to cut that open the vertical portions, so that we can easily drain out the that the drainage and do our work. Okay. And for this we have to that place the animal in a lateral recumbency positions by keeping that the affected ear on upper side position. Okay. And the site of operation is that ventral to the craniocaudal aspect of this ear canal. Okay. Let's see the surgical technique which we need to follow while performing this jab operation. At first we have to calculate the length of this vertical portion of ear with the help of probe. Okay. And now we have to make a two parallel incisions which is starting on that either side of tragus. Okay. And the incision should be that the about the half time more length as compared to the vertical canal. Okay. And we have to join this incisions with the horizontal incisions on the ventral side. Okay. Now we have to dissect out the skin flap and also subcut tissue, and reflect them dorsally. Okay. And now we have to that incise the lateral cartilage, you know, and then we have to that extend this incision ventrally up to that up to it reach to the horizontal ear canal level. Now we have to reflect this cartilage flap also ventrally, and we have to that expose the orifice of horizontal canal, and we have to perform our that operation. Now we have to that suture after the operation we have to suture this cartilage and this skin by mean of simple interrupted suture pattern. Okay. Questions number 5. A condition in which fetid odor come out due to Spirophorus necrophorus bacterial infection is option A thrush, options B canker, option C wind puff, options D founder. The right answer is options A, that is thrush. Okay. Thrush is actually a conditions where the fetid like smelly smells like that odor will be coming out from the wound because of Saprophoros necrophorus bacteria infections. Okay. Thrush is actually there's a chronic type degenerative condition of a frog, and it's actually characterized by there's a presence of a black necrotic fetid odor and as well as a fluid material in the in this food. Okay. And it is actually occur due to that unhygienic conditions and muddy ground. Okay. For the treatment of this thrush we have to apply 10% phenol and then tincture iodine and 10% formalin for the treatment of this thrush. Okay. Now second is curb. Okay. Inflammation of curb is nothing, is just an inflammation of the plantar ligament over the fistular tarsals bone. Okay. Now there's a string halt. String halt is that actually that the it is a flexion of the hawk. It is, if we see that is nature, it is actually that the nervous is origin. Okay. Now canker is nothing, is that hypertrophy conditions of this epidermis, skin epidermis, like this horny tissue, horns producing tissue of the soles. And in order to that remove this hypertrophy condition we have to use like cauterizing agents like CuSO4 and zinc oxide is used as a cauterizing agents. Okay. Buttress food is mainly characterized by two things. There is that exostosis conditions, and there's an inflammation of this coronary band we found. And there is a exostosis, that's a bone extra bone is formations in that third phalanx. It is actually associated with low ring bone, and its major cause of this buttress food is like contusion. Okay. Con is the involvement of sensitive and insensitive tissue at angle of wall and bar due to pressure of shoes. Okay. And quitor is actually that the purulent, that's a pus forming inflammation of collateral cartilage of coffin joint. Okay. Side bone is that ossification of this collateral cartilage of digital joint. Okay. Ring bone is like new bone growth of first, second, and third phalanx. Okay. Bog spavin is like a chronic distension of a joint capsule of hook joint. It's actually characterized by three characteristic soiling. Okay. While if we wind puff is nothing, is the synovial soiling of these joint capsules and tendon sheet. And in case of this wind puff, we doesn't found there is a lameness. This condition is actually developed due to poor nutritional status. Similarly, laminitis is also known as founder. It's a There's a no bacteria, virus, or parasitic agent is found. It is actually a septic type of spontaneous inflammations of the laminae of food. Okay. And this if we see the reasons behind it, we found it's a high amount of histamine in there, and it's mainly seen in that obese animals and such type of animals. So like there's a hind limbs found under the body, and there they so there's a forelimbs is forwarded. Okay. Questions number 6. Medial deviation of carpal joint is options A noctini, options B calfini, option C buctini, or options D bow-like. The right answer is options A, that is noctini. Okay. Carpal joint medial deviation is known as noctini. If the backward deviation of this carpal joint, that is known as shipni or calfini. And if we found there's an anterior deviation of this carpal joint, that is known as buctini. Okay. Questions number 7. If hernial content is uterus, then it is termed as options A osteocils, options B bubonocils, option C hysterocils, or options D vesiculocils. The right answer is option C, that is hysterocils. Okay. In hernia, if hernial content is uterus, then it is known as hysterocils. If hernial content is scrotum, then it is known as osteocils. If hernial content is inguinal vein or inguinal canal, that is known as bubonocils. Okay. This inguinal hernia is mainly seen in that ram and bull, which is occur due to that mounting of other animal. Okay. If hernial content is bladder, then it is known as vesiculocele. If hernial content is intestine, that is termed as enterocele. If hernial content is omentum, then it is epiplocele. Okay. If hernial content is reticulum, then it is reticulocele. Okay. If hernial content is both omentum and intestine, since we know that intestine term is entero and omentum term is epiplo, so it's epiplo enterocele. Okay. Diaphragmatic among all hernia, diaphragmatic hernia is actually internal hernia. Okay. Hernia frequently occurs in bovine calf, that is actually umbilical hernia. Okay. And in those animal which more kicking at their abdominal wall, at the time we found there is a large amount of ventral hernia. Okay. For that the correction of this hernia, we use that hernioplasty. And for the hernioplasty, we mainly use that body part tissues like full skin, dura mater, fascia lata, and sometimes we use that non body structures like teflon. Okay. And if we see that hernia, then it's mainly constituted of three things. That's a hernial sac, and there's a hernial content which come out from that hernial ring. So that's hernial ring. Okay. Questions number 8. In ruminotomy, which type of suture is used? Options A lumbar and cushing, options B lock stitch, option C vertical mattress, options D horizontal mattress. The right answer is options A, that is lumbar and cushing. Okay. In ruminotomy, because during ruminotomy there is a hollow organ, we have to that sew that hollow organ, so we use that inverted type of suture, that is lumbar and cushing suture pattern. Okay. In right displacement of abomasum during abomasopaxy, we actually use lock stitch suture pattern. Similarly, lock stitch suture pattern is also used during that when there is a horn cancers, and for the we have to perform that dehorning operations, and we have to perform when there is a diaphragmatic hernia and cystography, that's when we have to sew that urinary bladder, we have to use that lock stitch suture pattern. Okay. Similarly, ischia median suture is used in intestinal obstructions and intestinal anastomosis. Okay. Now we have to classify the suture pattern. If we see that broadly, we have to classify two type of suture pattern, that's interrupted suture pattern and that's continuous suture pattern. We know that interrupted suture pattern, we give that individualist internal individual knot. Okay. And but in case of continuous, we give a single surgeon knot, and then we continue to sew that all the tissue and then end with a knot. Okay. But if we broadly classified the suture pattern, then we found there's a six type of suture pattern. Opposition suture is such type of sutures pattern in which wound edges are oppositions in manner. It is actually used in case of skin and muscles, like simple continuous, which is used in simple skin lacerated warm wound. Okay, simple interrupted lock stitch, cuticular and cross mattress, these are example of opposition suture. Similarly, inversion sutures is that those suture pattern in which that the wound edges that are inverted. Okay, it is mainly used in that hollow organ like intestine, uterus, stomach, extra, and it is used to prevent that leakage from this hollow organ, like example Lambert, Jobert, Cushing and Connell. And if we see that Cushing and Lambert, we found it's a such type of suture which passes all four layer of this the intestinal layer except the mucosa, while in Jobert and Connell we passes in all four layer. Okay, eversion sutures are those suture pattern in which that edges of the wound is everted. Okay, example of this is horizontal mattress and then vertical mattress. In case of tail gangrene, we used to that perform horizontal mattress suture, and in case of that tit fistula operation, we used to perform that vertical mattress suture. Okay, similarly, persisting sutures is actually is it used to reduce the opening and also to invert the lumen or hollow organ. Okay, it is also used to that constrict that opening after a rectal prolapse, and also that to secure the catheter or thoracotomy tube. Okay, similarly, Burner type of suture is also a special type of persisting suture. It is used to suture vaginal prolapse condition. Okay, and next is that miscellaneous like include like relaxation and tension suture, which include like overlapping suture, which is mainly performed in case of hernia case. Okay, similarly tendon suture, staple suture, stay or retention suture. Similarly, quill suture after that prolapse of this vagina and uterus, after the replacement, we used to perform that quill suture. Okay, questions number 9. Which one physiotherapy technique is not recommended in orthopedic cases where a metallic object has been used as graft material? Options A, ultrasonic. Options B, diathermy. Option C, whirlpool bath. Or options D, all of above. The right answer is options A, that is diathermy. Okay, diathermy technique is not recommended in orthopedic cases where that metallic object is used as a graft material. Okay, if we see that physiotherapy term itself implies there is a physical therapy. It is a physical therapy is used in order to that diagnose and treat the some kind of disease, disorder and disability. And if we see that physiotherapy, there are different type of physiotherapy like diathermy. Diathermy is a special type of physiotherapy in which we use that electrical current which generate the heat in that layers of skin below the surface. It is also known as deep heating. Okay, similarly, ultrasonic is a such type of physiotherapy in which sound wave is used, which is greater than 20,000 hertz, and it is transforming in the form of mechanical vibration, and it is used to treat various type of musculoskeletal pathologies like osteoarthritis, soft tissue soldier pathology, and myofascial pain. Okay. Similarly, wax therapy is a special type of physiotherapy in which we use that molten wax. Okay, and it is used to apply heat to improve mobility by warming that connective tissue. Similarly, moisture therapy in which we use that hot pack of the that heat, and we use that hot pack on that painful area and left there for the 10 to 15 minutes, and it's also used to control pain, speed healing, relax muscles and increase range of motions. Okay, similarly, interferential therapy, in this case we use that electrical current, but low frequency electrical current that generate a frequency, and it is used to prevent a pain signal from being transmitted to the brain. Okay, similarly, TENS is stand for transcutaneous electrical nerve stimulation. In this method, electrical stimulations, its main aim is to provide a degree of symptomatic pain relief by exciting that sensory nerves, and also stimulating either the pain get mechanisms or the opioid systems is that natural pain removing systems will be activated in this mechanism. Okay, traction itself imply for that the applying of the force. Okay, in this portion that we apply the force in order to draw the two adjacent bone apart, so that we can increase their shared joint spaces and reduces the pain. Okay, Questions number 10. General anesthesia is necessary in which? Options A. Inguinal hernia. Options B. Diaphragmatic hernia. Option C. Cystorrhaphy. Or options D. All. The right answer is options D. That is all. Okay. General anesthesia is used in all cases like inguinal hernia operation, diaphragmatic hernia, cystorrhaphy, and flathead or collapse trachea operations. Okay, while epidural anesthesia is used in case of urethrotomy and perineal hernia. Okay, if you see that the most common site of this epidural anesthesia administration in case of cattle, camel, and buffalo is that sacrococcygeal in vertebral space, that is last S5 and coccygeal first, and another is that intercoccygeal intervertebral space, that is coccygeal first and coccygeal second. Okay, questions number 11. Crisscross incision is used in options A. Atresia ani, options B. Preputial prolapse, option C. Diaphragmatic hernia, or options D. Phimosis. The right answer is options A, that is Atresia ani. Okay. Crisscross type incision is used in case of Atresia ani, while a semi-lunar type incision used in case of diaphragmatic hernia, while a triangular shape incision is used in case of phimosis, while a circumscribal incision used in case of preputial prolapse. Okay, and incisions is done in front of this occiput in case of polyval, that is fistular wither cases. Okay, while incisions from one jugular furrow to up to that the another jugular furrow is conducted in case of wind sucking conditions. Okay, questions number 12. Prepubic paramedian approach is used for which operation? Options A. Esophageal obstruction. Options B. Fifth ribs dissection. Option C. Urethrotomy. Options D. Cystorrhaphy. The right answer is options D. That is cystorrhaphy. Okay. A prepubic paramedian approach is used in case of cystorrhaphy, while ischial approach is used in case of urethrotomy. Okay, and we all know that in case of for that pericardial drainage, we have to that dissect fifth ribs. Okay, similarly in case of that laryngeal hemiplegia, that is roaring, we have to cut cricothyroid ligament. Similarly for that left flank omentoplaxy, we used to perform Utrecht method. Okay, similarly laparotomy is conducted in following cases. What is the laparotomy? Laparotomy is just a operation in which we open the abdominal canal. Okay, abdomen. Okay, we have to open that abdomen, we goes to the abdominal cavity. Okay, for that diaphragmatic hernia, we used to perform posterior xiphoid laparotomy. For cesarean section, we used to perform posterior aspect of left flank laparotomy. For intestinal obstruction case, we used to perform right flank laparotomy. Okay, questions number 13. Cleft palate condition mostly found in options A. Young horses, options B. Adult horses, option C. Ox, options D. Pig. The right answer is options A, that is young horses. Okay. Cleft palate, there's a cleavage in the palate. Condition is mostly found in case of young horses. Okay. It is also known as palatochesis. It's actually a rare type of congenital defect which is seen in that fall. Okay, and this cleft palate is mainly caused by interruption in embryologic closure that occur along the midline in a rostral to caudate direction of the palatal fold, and may therefore involve a portion of the soft palate or of the hard palate, and sometimes soft palate alone. Okay, exact etiology of this cleft palate condition is unknown, but it may be due to that genetic factors, nutritional factors, teratogen, and traumatic mechanical factors. They may cause that could affect the palatal fold closure during the 47th day of the gestations. It's that possible causes. And if we see that it's clinical signs, that's a milk drainage will be from the foal's nose after nursing, coughing, and sign of aspirations. Okay, questions number 14. Frontal sinus has posterior orbital diverticulum in options A. Horse, options B. Ox, option C. Both, options D. None. The right answer is options B, that is ox. Okay, frontal sinus has that posterior orbital diverticulum in case of that oxes, and if we see that frontal sinus of ox, it is also divided by a thin bony type of septum in case of oxes, And if we see that there's a line which connecting mid of orbit is anterior limit of the frontal sinus in ox. Well, let's see the frontal bone of horse. Then if we see that frontal bone of horse frontal bone is situated between the two bone, that is parietal bone and nasal bone. Parietal bone is behind and the nasal bones are in front, okay. And if we see the size of this frontal bone of horse is smaller as compared to that ox, okay. And the supraorbital foramina perforate the root of supraorbital process, okay. And the supraorbital foramina join this the zygomatic process of squamous temporal, okay. And as like in that ox there is a horn core is presence, but in case of horse that horn core is absence, okay. And if we see that is this two frontal bone inferior border is actually have a projection, and this projection actually fit with that the notch which is presence in that two nasals bone, okay. And let's see the frontal bone of dog. If we see the frontal bone of dog is its locations and its extent uh, much resembles with that frontal bone of horses, okay. But its external surface, there is a presence of frontal crest, okay. um, Frontal crest, and which is that extend up to that supraorbital process, okay. And this and the frontal, it is frontal part have a central depression, and in front there is a narrow nasal part too, which actually fits in between that nasals bone and maxilla, okay. And if it see its supraorbital process, its supraorbital process is short and blunt, and its orbital rim is incomplete, and it's but it, we have to remember that supraorbital foramina is absent in case of dog, and in place of that there's a two ethmoidal foramina are present, okay. And if we see the frontal bone of fowl, it's the largest bone of the cranium in case of fowl, and it consists of body and orbital plate, okay. Questions number 15. Upper jaw is longer than lower jaw. That the condition is called, options A brachynethism or parrot jaw, options B prognathism, and option C scissor mouth, or options D all. The right answer is options A, that is brachynethism and or parrot mouth, okay. When a upper jaw is longer than the lower jaw, that condition is known as brachynethisms or parrot jaw. And when the lower jaw is longer than upper jaw, that condition is known as prognathisms or Habsburg's jaw, okay. Scissor mouth is special type of conditions where the table of molar teeth is beveled from inside out, okay. Questions number 16. Inversion of the eyelid and cilia that brush against cornea is called, options A entropion, options B ectropion, option C trichiasis, options D dystrichiasis. The right answer is option C, that is entropion, okay. Entropion itself imply there's an inversion, okay. Inversion of the eyelid and the cilia and that brushes against cornea, that is known as entropion, okay. And during this entropion treatment we have to cut that elliptical piece of skin from lower eyelid, okay. Similarly, in case of eversion of eyelid, that is known as ectropion, no? Ectropion, and for its treatment we have to remove triangular piece from the lower eyelid, okay. And misdirection of this the hair which is tracked to cornea is known as trichiasis, okay. If there is a two layer of eyelashes, that condition is known as dystrichiasis, okay. If there is only one eye which is present in the center of the head, that condition is known as cyclops equi, okay. Vascular thickening of the conjunctiva toward media canthus, that condition is known as pterygium, okay. Skin and hair growth at corneoscleral junction, that is known as dermoid, okay. Closure of the nasolacrimal duct due to the dust particle, that condition is dacrovastitis, okay. And varying degree of cloudiness in cornea which interfere with vision, that known is corneal opacity, okay. If there is a ulcer above the cornea which is not healing type ulcer, that is known as corneal ulcer. For this to cure of this corneal ulcer we have to perform apron type keratoplasty, okay. Opacity of eye lens, that is known as cataract, okay. A condition in which intraocular pressure is increased, that is known as glaucoma. For to correct this glaucoma we have to perform cyclodialysis surgical technique and iridendasis surgical technique, okay. A condition in which eyelid is dropped, that is known as ptosis, okay. A surgical technique of removal of that enucleation, that is known as exenteration and evisceration. Okay. Questions number 17. A condition in which absence of eyeball is called options A anophthalmos, options B microphthalmos, option C buphthαλmos, options D exophthalmos. The right answer is option C, that is anophthalmos. Okay. A condition in which absence of eyeball, anophthalmos. A condition in which that globes is a small size, that is microphthalmos. A conditions where there is a bulging of eyeball due to that excessive fluid in interior chamber, that is known as buphthαλmos. Okay. Abnormal protrusions of the eye globes, that is known as exophthalmos. Okay. Sinking of this eyeball, that is known as enophthalmos. Okay. If eye is excessively large without any fluid, that is known as megalophthalmos. Okay. A restricted development of eye in all dimension, that is known as nanophthalmos. Okay. Involuntary movement of eyeball resulting from unequal tonus in two antagonistic muscles of eye, that is known as nystagmus. Okay. Deviation of globe from its normal axis due to excessive tension, that is known as strabismus. Okay. Enlargement of tarsals gland is known as chalagion. Okay. Extensive edematous condition of conjunctiva, that is known as chymosis. Collection of a blood in anterior chamber of eye, that is known as hyphemia. Collection of a pus in anterior chamber of eye, that is known as hypopyon. Absence of iris, that is known as aniridia. Inflammation of iris and ciliary body, that is known as iridocylitis. Okay. Questions number that is 18. Benign tumor of surface epithelium is called options A papilloma, options B melanoma, option C squamous cell carcinoma, options D lipoma. The right answer is option C, that is papilloma. We have to remember that for benign tumor we use suffix oma, while epithelial cells cancer we used to term carcinoma, and for that smooth cells cancer we used to term sarcoma. Okay. So benign tumor of surface epithelium, that is known as papilloma. Benign tumor of melanoblast, we use that melanoma. Benign tumor of fatty tissue, that is lipoma. Horn cancers in blood, that is squamous cells carcinoma. Benign neoplasm of smooth muscles, leiomyoma. While malignant neoplasm of smooth muscle, that is leiomyosarcoma. Benign tumor of striated muscles, rhabdomyoma. Benign tumor of cartilage cells, chondroma. Malignant tumor of synovial sheath and tendon, synovial sarcoma. Okay. Questions number 19. Inflammation of stifle joint is called options A gonitis, options B cositis, option C spavin, options D pedal osteitis. The right answer is options A, that is gonitis. Okay. Inflammation of stifle joint is gonitis. Inflammation of hip joint is cositis. Arthritis of hock joint is a spavin. Inflammation of coffin joint is pedal osteitis. Tenosynovitis of tarsal sheath, that is thropin. Okay. Questions number 20. Diverticulum of esophagus is treated by options A manually, options B use probank, option C surgically, options D all. The right answer is options D, that is all. Okay. Diverticulum of esophagus is treated by manually use probank and surgically. Okay. Esophageal diverticulum is nothing, that's a outpouching or that pocket formation which is occur that inside the esophagus. It occurs actually where there's a weak spot in the esophageal lining. Okay. It protrude outward forming little cavern. Okay. And main causes of this esophageal diverticulum is aclasia, esophageal spasm, esophageal stricture, eosinophilic esophagitis. Okay. Questions number 21st. Shift to left test is used for option A right displacement of abomasum, options B left displacement of abomasum, option C traumatic reticuloperitonitis, options D diaphragmatic hernia. The right answer is option C, that is a traumatic reticuloperitonitis. Okay. Shift to left test is used to test TRP. Similarly, in case of traumatic reticuloperitonitis, jugular vein is raised. Okay. And if we see that animal stand with abduction of elbow, and there is a pain when animal going to the downhill walking. Okay. And if we see the heart, it will appear like a bread and butter appearance, there is an heart. Okay. And if we take the blood test, we found there is a hypocalcemia conditions. Okay. And if we see that animal, that bovine is more prone to this TRP conditions because of their anatomical structure of abdominal viscera. Okay. Similarly, if we see that diaphragmatic hernia, we found there's a persistent type of frothy tympani is found, okay. And this diaphragmatic hernia, actually that the abdominal content goes to the thoracic cavity by punctured this diaphragm, actually which portion, that is tendinous portion of a diaphragm, okay. And if we see that right displacement of abomasum, we can found there's a abomasum can be palpated high in right flank on rectal examinations, okay. And we found some degree of volvulus also too, okay. And in case of left displacement of abomasum, we have to perform liptech test to diagnose this left displacement abomasum. Questions number 22. Soft, non-ulcerated masses arises from nasals mucosa is known as options A, polyps, options B, granulomas, option C, neoplasm, options D, none of this. The right answer is options A, that is polyps, okay. Polyps is actually soft, non-ulcerated type masses which is arises from nasals mucosa, okay. If we see this polyps is actually pedunculated structures in nose, okay, and we have to that correct this polyps, we have to that surgically correct this polyps, okay. And if we see that neoplasm doesn't respond to this surgery. Granulomas is like a tumor which is like multifocal structures, and it's mainly caused by fungal infections, okay. Questions number 23. Genetically related disease is option A, diaphragmatic hernia, options B, left displacement of abomasum, option C, intestinal obstruction, or options D, atresia ani. The right answer is options D, that is atresia ani, okay. Genetically related disease is atresia ani. Atresia ani is actually a congenital embryological anomaly in which that hind gut is failed to fully communicate with the perineum, so that sometimes that anus is stenosis or imperforate, sometimes that anus only that stenosis or imperforate, or sometimes it is come along with that in combination with rectovaginal and rectovestibular fistula, okay. Questions are number 24. For pneumoectomy, appropriate site of incision is options A, 5th ribs, options B, 8th ribs, option C, 7th ribs, options D, 5 to 6, 7th intercostal space. The right answer is options A, that is we have to incise on a 5th ribs, okay. To perform pneumoectomy, we have to appropriate site of incision is 5th ribs, okay. For thoracocentesis, we have to appropriate site for incision is 5th to 7th intercostal spaces. In order to drainage of pericardial sac, we appropriate site for incision is 5th ribs. For lobectomy of left side lobe, appropriate site of incision is 5th ribs. For diaphragmatic lobectomy, appropriate site is also 5th ribs. Okay. For transthoracic osophagotomy, appropriate site is 8th ribs. Okay. Questions number 25. Air accumulates in pleural space is called option C, pneumothorax, options B, pyothorax, option C, hemothorax, options D, hydrothorax. The right answer is option C, that is a pneumothorax. Pneumo term itself imply air, okay? Air accumulate in pleural space, pneumothorax. Hemo imply terms blood. Blood accumulate in pleural space, hemothorax. Pyo implies for pus. Pus accumulate in pleural space, pyothorax. Hydro imply for water. Water or serous fluid accumulate in pleural space, hydrothorax. Okay. Questions number 26. Congenital cardiac defect are option C, ectopic carditis, options B, patent foramen ovale, option C, tetralogia fallot, options D, all of above. The right answer is options D, that is all of above. Okay. Congenital cardiac defects are like ectopic carditis. Term itself imply ectopic, ectopia. Ectopia means like there's a heart presence outside the thoracic cavity. Okay. And patent foramen ovale, it's a conditions in which there is a hole between that the right and left arteria. Okay. And this hole actually that get closer after the birth, but if it remain, and then it form that patent foramen ovale. Okay. Tetralogia fallot, tetra term itself, in fact there is a four conditions. Okay, there's a four problems with heart structure. One is like there's a pulmonary valve stenosis means that constriction of this, narrowing of this pulmonary valve. Okay. And okay, results in that reduced blood flow from the heart to the lungs. Okay. Similarly, ventricular septal defect, two ventricles is separated from the septals, but there's a septal defect, so these two ventricles get connected. Okay. Shifting of the aorta. Aorta is actually located to that left lower heart chamber. But in this tetralogy, this aorta is shifted to the right, and it sit directly above the hole in the heart wall. Okay. And next is like right ventricular hypertrophy. Hypertrophy means increases in the size of this ventricles. Okay, there's a thickening of this ventricular, or right ventricular is get thickened. Okay, this may cause that heart to become weak, and eventually it may also lead to that heart failure conditions. Okay, questions number 27. In ox, sigmoid flexure is found. Options A, caudal to scrotum, that is post-scrotal places. Options B, pre-scrotal. Option C, parallel to scrotum. Options D, none. The right answer is options A, that is caudal to scrotum, that is post-scrotal. Okay. If we see that what is a sigmoid flexure is nothing, is a S-shaped curve, and then that strong retractor muscles hold the penis in the shape of this S-shaped configuration. Okay, and if we see that in ox, this sigmoid close flexure is found, that posterior scrotum, that's caudal to scrotum. Okay, but in case of camel it is found that pre-scrotal. Okay, in case of ram it's also found in that post-scrotal position. In boar, if we see that sigmoid flexure is located midway along the urethra. Mm, okay, while sigmoid flexure is absent in case of horse. Questions number 28. Most common urethra obstruction site in camel is. Options A, sigmoid flexure. Options B, terminal part of urethra. Option C, urethral process. Or options D, os penis. The right answer is options B, that is a terminal part of urethra. Okay, a urethral obstruction site in case of ram is that urethral process, while urethral obstruction site in case of dog is os penis. Urethral obstruction site in case of cattle is actually distal portion of the sigmoid flexure, while urethral obstruction site we see that in horse is that is that the is part of that urethra, that is curving form is urethra, which is mainly near to that ischial arc. Okay. Questions number 29. Water belly condition appear in which of the following? Options A, that is obstructive urolithiasis. Options B, that is traumatic peritonitis. Option C, that is rupture of urethra. Or options D, that is pervious urachus. The right answer is options that is A, that is obstructive urolithiasis. Okay, water belly conditions appear uh, in case of obstructive urolithiasis, and we have to that for that the confirmation of this obstructive urolithiasis we have to perform paracentesis abdominis. Okay, and because due to that urethritis is like inflammation of urethra, that obstructive urolithiasis is frequently occurs in case of camel. Okay, while in case of traumatic peritonitis we majorly found a brisket edema. Okay, the treatment of this traumatic peritonitis is that multiple stab incision is done at that affected area. Okay, similarly in case of rupture of urethra we found there is a that urine get the urine get that spill out. Okay, so that extensive subcutaneous infiltration of urine we can see in case of rupture of urethra. Similarly pervious urachus is a actually congenital anomalies in which that urine dribble from that umbilicus, and that area remain wet, and for this treatment we have to use 90% phenol is used for the treatment of this condition. Okay. Questions number 30. Vasa difference is cut in which condition? Options A, vasectomy. Options B, castration. Options C, phimosis. Or options D, paraphimosis. The right answer is options A, that is a vasectomy. Okay. Vasa difference is cut in case of vasectomy. Teaser's bulls, like teaser's bulls is that those bulls which is the bull which is used to detect the animal in heat condition. Okay, teaser's bulls is produced by mean of vasectomy. Okay. Similarly, removal of testes, that process known as castrations. Most common congenital anomalies of penis, that is persistent frenulum. It's a condition in which there is that membrane which is located between the penis and the prepuce. Okay, a conditions in which one testis is descent in scrotum, that is known as monoarchid. Mono itself implied as a single. A condition in which testis found other than scrotal sex, ectopic term itself imply, okay, that the not located in that original position. Okay, testis, okay. Removal of ovary, ovarectomy. Ectomy is that totally removal, okay. Incise the skin around the dorsal commissure of a vulva, that is episiotomy, okay. Surgical removal of part of penis, so is penectomy, okay. Removal of uterus, whole uterus will be removed, so hysterectomy, okay. That's much for today. We will meet you soon in next lecture, okay. Thank you, class.